We deliver our services to employers and their employees really through decision support. It's healthcare decision support. The truth is, when people get sick or hurt or have questions about diet or nutrition or exercise, the sorts of things that contribute to our wellness, they often don't know what to do. And it turns out you have to go to the doctor and incur a claim and costs in order to find out if you needed to go to the doctor. That's the way the system's built. There is no entry point that helps individual people make good decisions about what to do next after they've gotten hurt or sick, or if they're trying to prevent that. So that's how we step in, and Medcor supports its patients and our clients by helping make decisions at the moment that the decisions need to be made and getting people on the right track. So if self-care is appropriate, we'll guide you on how to do that. If it's care that we can provide, we'll provide that care. And if you need a referral to something more sophisticated or a specialty area, we'll get that sooner rather than later. So the result is people aren't going to the ERs unnecessarily, and serious cases aren't being missed. We run on-site clinics for large employer spaces, so that we'll put a clinic with staff and systems and software dedicated to one employer and all of the people, could be their employees and dependents, that they're responsible for, and they get to use the clinic. We don't bill insurance. So the experience is very different. You walk in, who are you, and you're seen right away. So we take same-day appointments, walk-ins. You can look online and make an appointment. You can get help making decisions about what to do and get basic care. We'll typically be able to handle 70% or more of primary care needs, over 80% of occupational and work comp needs, and the rest of patients can be directed into the traditional system appropriately. For small work sites, mobile workers, after hours, we use a variety of telehealth. We have a call center with more than 100 nurses. We have some patented processes, and we've taken more than 1 million triage calls. And we've been able to resolve 40% of those cases with self-care over the phone, simply. And that's been a great advantage for employers who aren't large enough to have a clinic on site. So Ozaukee County is a customer in Wisconsin, and they very much wanted to improve access and control costs, but they're fully insured. So the costs would accrue to them and the savings would accrue to their insurance company, and they couldn't find a way to make it work. What we did was a 3-way agreement where we worked with their insurance company, and the insurance company is actually technically our client. They get the savings, they pay the bills, but also the healthcare benefits accrue to their policyholder, the county. So there's kind of this 3-way win. And that's a success from a business standpoint, not really clinical. So you got to figure out business models that will bring those clinical solutions to employers.